Hi, Kathy Ewing here. Hi, we are on site at the dog pool. Thanks for everybody for joining us. I wanted to make a couple of announcements. We have some new members that are joining, and in a moment, Judy will be welcoming all those new members. And we want to thank you for joining in today to hear our talk on dental for all of our dogs. It'll be a great presentation, so stand by. I'm going to go ahead and introduce our speaker for this evening, Gary Modrcin. Now, those that are joining us on Zoom, you will be able to see his presentation. I'm going to share it with you now, but you will not be seeing him. You will be seeing just the presentation, but you will be able to hear him clearly. If anybody has any problems technically, please write a note in the chat, and Tom will let me know and we will try to address that. So at this time, I'm really proud to introduce Dr. Gary this evening. He's a board certified veterinary dentist, the co-founder of BluePearl Veterinary Partners and Specialty Emergency Center. He's the founder of College Boulevard Animal Hospital and the past president of both the Kansas City and Kansas Veterinary Medical Association. Gary is married to wife Anne. She is also a doctor. They have a beautiful daughter, Taylor Modrcin, and an exceptional Welsh Corgi named Ellie. He's currently temporarily retired and resides in Olathe, Kansas, and also has a home in Parrish, Florida. So without further ado, please welcome Dr. Gary Modrcin.
Thank you, Kathy. As I mentioned before, it's been about 40 years ago that I got my first dog as a veterinarian. And it was a golden retriever. I tried to teach her a lot, but I actually think she taught me much more. Patience is definitely important. So one thing that's happened in the last 40 years is that last fall, the American Veterinary Medical Association finally made dentistry a required curriculum for new veterinary students. So prior to that time, it was always considered an elective. So most of the veterinarians that have graduated in the last 40 years have had little to no training in dentistry. So a lot of times when you get recommendations from your veterinarian, it may have been hands-on, or they did at their clinic, or may have gone through continuing education first, but no formal training whatsoever. So I'm going to review a few little basics, and then most of this talk is going to be about oral pathology, things that I think as owners you guys can do a little bit on your own to identify, and there are some secrets.
I'm going to have you go with that side, because you can absolutely see.
There you go.
Yeah. Okay.
Please. Oh. Let me go back. Just a moment. Let me close out and bring it up again. Jeez. Just a second. I'm not sure what it's, hold on. Still doing it. Did it go all the way in? No.
But let's just do it back on that one before.
Okay, hold on a second.
Slideshow and then let me just see if it'll work out.
Okay, I think, pardon me. Okay, I'm gonna leave it on this view.
That's fine. Let me see if
Okay,
it'll go
and then I
backwards.
think it'll go. You wanna go back?
Yeah. Maybe I'll have to do it manually. I think.
Boy, I don't know it was working before. Mm-hmm. That's me pushing it. Is it working for you?
I just did that.
You did. Okay, so you can.
Okay, we will start. So the very first thing that we need to know about our dogs is, well, how many teeth are they supposed to have? They're supposed to have 42 teeth. So one of the first things that I like to tell people is to make sure that your veterinarian is in fact sure that all of the adult dentition is in. Because if you are not having 42 teeth, that means it's either genetically missing them or they're unerupted. And an unerupted tooth is a problem. So they can easily do that at the time that dogs may be neutered or spayed. You X-ray to see if there's missing teeth at that time. But it's one of the first things that you should always find out is, do you have the correct number of teeth? The next thing you need to find out is, does my dog have a normal bite? So a normal bite for a golden retriever is a scissor bite. That also implies that the premolars interdigitate on the side. They're not point to point, they're like pinking shears. And that big, large tooth that you see over there towards the right-hand side is the upper fourth premolar. It's called the carnasal tooth. And it overlaps the first molar, which is the mandibular carnasal tooth. So you should not be able to see that mandibular molar if the bite is closed. So if you see anything but this, then the bite is incorrect. They either have breaking atheism, but there's lots of other possibilities. So the anatomy of the tooth is kind of important. Real quick review, the outside is lined with enamel. Supporting structures underneath is dentin, and inside that tooth is called what's called the pulp canal. So a normal for periodontal disease is what we're going to look at. So healthy gums will be on the left. That means that you should have a 1 millimeter sulcus. Same thing they request for human beings. If it's deeper than 1 millimeter for that gingiva and the bone or the root is starting to be exposed, then periodontal disease is evident. So this is what we would normally see in a dog that has periodontal disease. There may or may not be calculus on the tooth. That's not an indicator of periodontal disease by itself. If calculus is below the gum line and we have red swollen gums, that is an indicator of periodontal disease. So I'm going to show you this as an oral exam. The gingiva should melt into the side of the tooth like a knife. It should be coral pink. We should have. So if in fact we see calculus on the tooth, that's not disease. Calculus under the gum line is disease. So this particular dog is 11 years old. She's never had a professional cleaning. I brush her teeth every day. So this is what a puppy's mouth looks like, and this is what your dog's mouth should look like. Once a day, takes me 20 seconds to brush her teeth. Very, very important for lots of reasons. If I brush her teeth and the toothbrush shows blood on it, and I'm doing it every day, and I know I've got a problem, immediately, regardless of how well she's eating or anything else that's going on, that's your indicator that disease may be present. It's not the only indicator, but a dog will never stop eating, even with the largest tumor in its mouth. So you can't use appetite as an indication. You have to look at the mouth. So those gums should be just coral pink, and the gingiva should just melt right into the tooth. That's a normal mouth, and at least 6 ways for a teeth brush to be every night. So most common fractures that we see in dogs are what's called complicated crown fractures, and they're usually of that carnasal tooth. And the reason is that's where dogs put anything they're going to chew way back in the back of their mouth. So that big tooth that we saw in the previous slides, that's the one that gets fractured the most, because that's when they're trying to chew something that's too hard. So if a dog comes in to us with a fractured carnasal tooth or upper fourth premolar, there's really only 2 good methods to take care of that tooth. One is to do a root canal and put a crown on it, and the other is to extract it, because further breakage is going to occur. And the reason it's going to occur is that tooth's going to die. It's going to become infected. And as soon as it becomes infected, the nerve dies. Now the dog has no feedback that that tooth hurts until the abscess starts to form. So it's really important that we look at a dog's mouth, not just from a bleeding standpoint, but recognize that any fracture on a dog's tooth could be a serious problem. So many veterinarians have sent owners over eventually saying, well, it doesn't seem to be bothering him. We got a fracture, you can stick a probe up in the root canal, but the reason it's not bothering him was because the nerve died. So there's nothing for that dog to feel at that time. Eventually, though, they will feel it. So that dog had a periodical abscess. We can see it right there, little lucency around it. The owner elected to have the tooth removed, which is what I would agree with. That tooth didn't have much crown left to do a root canal on or put a crown on it. So sometimes the pathology is hidden. If we look at the slide on the left, it looks like pretty normal gingiva, maybe a little swollen from my standpoint, but the x-ray showed severe periodontal disease on the tooth right behind this first molar. You wouldn't be able to tell that by looking at it, but I can guarantee if you brush that dog's teeth, it's going to bleed. So the way that we look at it is preserve the most important tooth, preserve the carnasal tooth. So get rid of the other ones behind it. They're going to be infected. This owner wasn't brushing, so it's not going to be one of those things that we're going to save teeth from. Here's another one, same situation, advanced periodontal disease down the periodontal ligament area, loss of bone over 50% of the height of the root. So we took out the tooth behind, we did a bone graft in here to save the carnasal tooth. This is a year later, so we can save some teeth, can't save them all. So this actually was owned by a veterinarian. You know, we came in, we did dental cleanings on him, and I'll let all of that be going. But I cleaned up his teeth, and I told him after we took the films that she probably needs 12 extractions. She needs that because 50% of the bone loss has already occurred. So he can't possibly clean a 7mm pocket with a toothbrush. Your toothbrush can only clean 2 to 3 millimeters. So if your own dentist says you've got a pocket that's 4 millimeters deep, the very first thing they're going to do is send you to a periodontist, and they're going to up your cleanings to 3 or 4 times a year to try to stabilize that pocket. So another one that's real common is discolored teeth. So we see this a lot in Goldens. They play ball, they chase things, they catch things. If they bump that tooth just wrong and it hemorrhages inside the tooth, they can get what's called irreversible necrotic pulpitis. And those dogs are painful. It's not a wait and watch situation. That dog needs to have its canine teeth have a root canal, or it needs to have it removed. We see this all too commonly. They might be blue, they might be brown, but they usually start off with a little bit of a pink red And then as time goes on, they develop. And you can see just by looking at this dog, it wasn't the first trauma that occurred to this dog. It's got a fractured incisor there as well. So when we see discolored teeth like this, and oftentimes, you know, we're going to say, well, my veterinarian said it's not bothering the dog. It's not the case. 92% of all intrinsically stained teeth are dead and painful to the dog. The dog just can't find a way to tell us about it. So I'm going to relate a story real quick about one of the officers' dogs in Overland Park. They do bite work. 2 canines had intrinsic staining like this. The officer did notice that the dog was not biting the sleeve very well. So we brought him in, we x-rayed him, we did root canals and put crowns on so that he could still do his work. And the officer's very, very first recheck 6 months later was, he hasn't worked like this for over a year. So they can't tell us all the time what's going on. So another thing that we see real commonly is dogs that are aggressive chewers. And we can't tell whether or not that dog's ground down those teeth slowly or he's ground them down real fast. So the body has some pretty remarkable mechanisms. It can't replace the enamel. But if it wears down the tooth real slowly, it can put on what's called reparative dent, tertiary dent. And it'll look sometimes like little round circles right here and here. And that may indicate that the dog saved the tooth by laying it down if the erosion was slow, but it may not. If it erodes too quickly, then it exposes the pulp canal, and the pulp canal will be affected by the bacteria. So the other thing that happens, and this slide may not show it very well, but we see dogs that may have some inconsistencies in how the enamel was laid down on the tooth. And if there's pitting of that tooth, sometimes puppies can get it from a fever, and as the adult tooth erupts, we'll see pitting in the enamel. Once the enamel is pitted and exposes the secondary layer, the dent is like a sponge. It has all kinds of microtubules to allow bacteria to enter the tooth. So those dogs that have enamel hypocalcification or hypoplasia, they need to have all those defects filled so that their tooth remains healthy. Obviously, they need to be x-rayed annually. So there's lots of causes for endodontic disease. Another way of saying that is abscess tooth. Could be a fractured tooth, discolored tooth, malformed caries, even periodontal disease. So if we have a fractured tooth, it's going to enter that pulp canal and cause disease of that tooth. And eventually that tooth will develop a lucency at the very end, and it will abscess, and it'll either be extracted or it'll need a root canal to correct it. The dent, as I mentioned, could be real porous. So if that tooth has a small fracture on it, maybe not even one that looks all that terribly important, but it may allow contaminants to get into the dental tubules, or it may have what's called anachroresis, meaning the infection happens in the bloodstream and is deposited into the tooth. So we can look at those 3 incisors over here, and while they look pretty normal here, radiographically, they're all abscess. So when we see that and there's no fracture and there's no wear, you know, it could have been trauma, but another likelihood is it was a bloodborne infection that caused loss of the tooth. So an obvious one is periodontal disease. On large breed dogs, the actual molar is smaller to the jaw than it is on a small breed dog, where the molar is proportionally too large. So if that had been a Yorkie and it had that amount of lucency down here and here, this tooth root would be way down here towards the bottom of the cortex. And I can't tell you how many I've seen that came in with broken jaws as a result of secondary pathology from just a tooth that had periodontal disease. So lots of consequences for abnormal teeth. They may or may not be painful, at least from the dog standpoint. They may be very chronic, could cause bone infections like osteomyelitis, pathological jaw fractures, may eventually cause systemic disease. All of the abnormalities need to be radiographhed. Probably the number one I used to see in general practice, oops, let me go back, is broken deciduous canines. The puppy would get vigorous and chewing on a towel, or the owner would be throwing a ball, and that tooth would break, and the veterinarian might say, well, don't worry about it, it's just a puppy tooth. You know, it's going to lose it eventually. Problem is that puppy tooth, it's dead and has its pole exposed, its root's going to be infected, and the tip of that root lies right against the adult erupting tooth. So the heat of that infection on that baby tooth from the abscess will affect the enamel that's being laid down by the adult tooth. So everything has a consequence. So this is just tons of examples of that. We have broken tooth and a draining tract. Draining tract again, abscess tooth from the baby tooth, another draining tract. Very, very, very common. These are often missed because the tooth may or may not show anything on the outside. So common thing we used to see, swelling underneath the eye. Unfortunately, those people that might look at that might jump to the conclusion that it's going to be the fourth premolar, because it is probably 60% to 70% of the time. And sometimes they're extracted only to find out that the swelling doesn't go down, but they never took x-rays. So in this case, it did have a draining tract, but the draining tract was between two teeth. So you can't tell if it's a fourth premolar or you can't tell if it's a molar. So obviously nothing replaces the x-ray. The x-ray showed that it was a molar. Big, huge periapical lucency, showing that this abnormal swelling was actually due to the molar, not the fourth premolar with our nasal tooth. But I can't tell you how many got their tooth extracted. And then they come to me and say, well, he had it extracted. Or they left roots. They didn't get all the roots out. There's 3 roots to that teeth, both of those teeth. If they don't get them all out, it's going to reabscess again and again and again. So abrasion is another one. Abrasion is classified basically by a dog chewing on something, wearing down the teeth. It could be a frisbee, it could be a tennis ball, it could be a log, rock, but it's generally speaking will wear down the tooth. So most people don't know that probably the worst toy that you could give a dog that has an oral fixation, like your Goldens, is a tennis ball. The covering on the tennis ball will wear down that tooth in 2 years to half its size. And it can be prevented. Frisbees are probably number 2. Dogs like to catch these things. So there are safer things to put in a dog's mouth than either of those things. I used to tell clients, if you can't bend it and score it with your fingernail, then it's too hard to get to a dog to chew. Well, keeping in mind that all the chewing usually happens in the back of the mouth, not up here in the front of the incisors and canines. So here's a dog that had a tennis ball glove. And we consulted with this owner to try to stop some of the abuse to the teeth. But it's not just the canine teeth that are worn. If you can imagine a ball sitting right there, the angles of the canine teeth are just perfect for the roundness of a tennis ball. All of these in premolars are also worn down. So we x-rayed this dog. Fortunately, we wore him down slow enough. We didn't need to have root canal therapy. But the owner was unable to stop the dog's habit. So we ended up putting crowns on the canines. We made the crowns just a little longer so that he couldn't occlude with these premolars here if the ball was in his mouth. That's not to say that maybe eventually he did. Maybe he got 2 balls. We don't know. But this is definitely one of the things that we see commonly. Certainly something to avoid. As I mentioned, uncomplicated crown fractures means that the fracture did not expose the pulp canal, the nerve and vasculature of the tooth. So this particular dog had a really tiny cusp fracture right there, right on the tip. We told the owner that more than likely we should do root canal. She said no. We went ahead and x-rayed it. The x-ray looked pretty good. No lysis around any of the air roots. Told you we really ought to monitor this in 6 months to a year. We never saw her back. 2 years later, she came in. Now the tooth abscessed on all roots. Sometimes we can't predict how long that fracture was there. So the owner thought this fracture occurred last week. I look at it, it had calculus on it, on the fractured side. You know it'd been there a while, but you don't argue with it. You just say, this is our best recommendation. This is what needs to be done. So we ended up pulling those teeth. Owner didn't want to go through another episode of root canal, failure, and so forth. So this was a miniature ocelot, weighed about 7 pounds, fractured both of its upper 4 premolars. This owner took me to heart, says, do root canals and put crowns. And that's the proper thing to do for a fractured 4th premolar, because the dog will get to use a tooth that's really essential for its bite. So we see other types of pathology too. We mentioned swollen gingiva. So you can see how much swelling is here, all along here as well. When that swelling occurs, that makes that normal 1 millimeter pocket a 5 or 6 millimeter pocket. And we call those pseudo pockets because it's not really periodontal disease yet, but it's reacting like it should be. So we usually do gingival surgery on these. So this one's a 6-year-old golden, had a lot of gingival hyperplasia or what we call gingival enlargement. So we took pictures. You can barely see all of its incisors here. I'm sure you guys have seen dogs that have this. Probably it's more notable in the boxer if you were going to pick a breed, but it happens to a lot of different ones. So both sides had it as well. You can see it here and here. So we definitely x-ray these. Want to make sure that the teeth are normal to begin with. So once they've been x-rayed, we reduce that pocket back down to 1 millimeter. So now the body can take care of it. And if the owner brushes that dog's teeth after a 2-week healing period, it won't regrow back. But if they don't do anything, it's going to come back just like it was before. So there's 2-week recheck. Things are pretty smooth now. So another one we commonly see, maybe not quite as often in the golden retriever, but we definitely saw a lot in greyhounds, is when they develop a pocket, they get that short, stubbly hair up underneath the gingiva, and it causes what's called a periodontal abscess. So this dog needed to have that corrected. So his tooth was fine, but he only had 1 millimeter of attached gingiva up here. He needs 2 in order to keep the bone there so he can save the tooth. So we did surgery on it. We did what's called a lateral sliding pedicle graft to reestablish bony contact on that tooth. So we slid it over and basically covered the defect while not affecting any of his other teeth. We harvested tissue from teeth next door or the gingiva next door. So in 2 weeks, it looked like that. 6 weeks like that, 12 weeks like that. So there are tons of things that somebody that's experienced and recognizing what surgeries are successful can be done, but it also takes a commitment by the owner. So we talked about number of teeth. So it's important that we count the teeth. If a tooth is missing and it's left unerupted, it can cause a cyst. And that cyst can be slow growing over a long period of time. and eventually will cause bone loss or tooth loss. So one of the common ones is called the dentigerous cyst. So this dog, if you count the number of incisors right there, you only see 5 instead of 6. So we know he's got a missing tooth. He's got swelling of the right mandible. So we took x-rays and he lost all of the bone up here in front to support any of those teeth. 6 years old. He could have been identified when he was 6 months old if somebody had just counted the teeth. Simple thing to do. So obviously we had to remove all those. There's no bone support for those teeth. We put in a bone graft. The dogs can still eat and so forth, but he has no incisors. So another one, same type of thing, miniature schnauzer came in. It was also missing teeth. You can see this one little teeny peg tooth just floating in there. We ended up having to take quite a bit more on that dog because this canine tooth didn't have any bone support. It's on the right. This one here. So by the time we got all done, he lost that tooth as well. So there's his final x-rays. We put in a bone graft as well to strengthen up the jaw. The dog will end up doing fine, but there was no reason that somebody thought that earlier. So 2 weeks afterwards, the dog's doing great. So there can be complications from people doing work on the tooth. So there are lots of CE classes that probably teach veterinarians things they shouldn't get into. In this particular case, it came from Nebraska. It had root canals done on both sides 2 months prior. But every 2 weeks, the veterinarian had to put it on antibiotics to make this discharge go away. Well, that's what it looked like on the outside. Nothing suspicious. When we take it on the inside, and this may be hard to see, but he did root canals, but he only went halfway up the root. And he only did 2 of the 3 roots, not all of the roots. So basically, charged this owner an exorbitant amount of money. I told the owner, I said, I could go back and do root canals and correct them. She said, you know, we've been dealing with this for over a year and a half. He goes, just pull it. So that's what we did. Dog did fine. As you might guess, the veterinarian wasn't happy to hear that. But at the same time, we're not there to protect anybody. We're there to just tell them what we found. So oral tumors are the things that I think most veterinarians and owners miss until they get way too big. And the reason they miss them is nobody gets inside their dog's mouth. You know, put your finger there, run it along its gum line, find out if there's a bump that didn't used to be there, or find out if your dog's sensitive and all of a sudden you hit stop with a toothbrush. If that happens, then you know something needs to be looked at. And then to go somebody that will take a good look at the inside of that. So any swelling on the gingiva is called an epithelios. It's not a diagnosis, it's just a description. So tons of different types of scenarios go on in the mouth. And we're just going to hit a few. We mentioned gingival hyperplasia or enlargement. The pseudopockets, another case, we've seen one like it before. Another one that can happen is what's called gingival overgrowth, and it happens secondary to drugs that a dog may get. So if the dog's on cyclosporin for allergies, or if it's on calcium channel blockers for heart disease, or it's on phenobarb, they may develop gingival hyperplasia as a result of that and need some surgical assistance to control their pathology. So we just talked about that part. So this is what the dog looked like. We took x-rays. What his mandible looked like. We took films. We did surgery. So the goal is to bring back that pocket depth to 1 millimeter, not have any pseudo pockets, and make it manageable for the owner to brush this dog's teeth in. Because it can't get down to those 4 millimeter pockets when there's no stress. So focal fibrous hyperplasia is just a more severe condition of gingival hyperplasia or gingival enlargement. Once it gets started, brushing will not be used. It will need surgery.
corrected. And oftentimes we see the condition change from a benign to a more severe problem. So it's important not to let these things just linger. So one that's been lingering for a long time now looks like a tumor, but it's still fibrous focal fibrous hyperplasia. So peripheral odontogenic fibromas used to be called fibrous epilysis. Even the pathologists weren't describing them normally. They are a slow-growing benign neoplasm that comes off the periodontal ligament, the ligament that attaches the tooth to the bone. They can be removed without removing the tooth. If they reoccur, that means they need to take half-centimeter margins on each side and remove adjacent teeth plus the affected tooth. So we see these a lot. So sometimes they grow slowly. Sometimes there's no bony involvement in the jaw, but there's calcification of the tumor. Usually when you see these, our goal is to, especially in a large dog like Golden, we want to take 1 centimeter of tissue away, which means we would do what's called a marginal mandibulectomy. We're going to try to leave this ventral cortex down here. Then tons of those. In a small dog, where the jaw may be only 1 centimeter thick to begin with, we have to do what's called segmental mandibulectomy. We take the whole chunk out, and then as a result, the jaw will drift because it doesn't have any way to stay lined up. And we have to do either crown amputation on the other canine, or we have to put tension bands in. So another peripheral odontogenic fibroma is real common. The worst thing that your veterinarian could do is to take that off. The best thing we can do is to biopsy it in the middle of the tumor and send it off, because they all look alike. You can't look at these and say, oh yeah, it's a peripheral odontogenic fibroma, because you don't know what it is. That one looks different, same thing though. It looks completely different than the other one, but that's not a diagnosis in itself. This one involved quite a bit of bone. We biopsied it. It did come back with odontogenic fibroma. We did a marginal mandibulectomy to get it out of there. Very common in other areas of the mouth as well. This one was up in the incisor area. This one had been biopsied 3 times, but the veterinarians that biopsied took little teeny tiny pieces, not enough for the pathologist to give us the diagnosis. So we had to go in there and get aggressive right in the middle of it, send in soft tissue and bone, and find out for sure what it was. Another one right up in front. So they happen pretty frequently. Fortunately for large breed dogs, we usually can save the jaw. For the small breed dogs, we go through a lot of morbidity for that. So another one that's real common, but it's considered a benign tumor, but much more aggressive, is acanthomas meloblastoma. It can miss one holding part. It's very much destroys bone. So oftentimes it moves the tooth. So if you look at that center incisor on the right there, you can see how it's tilting to one direction. Something is moving that tooth. That's a good indicator that it's a much more aggressive tumor. It doesn't mean that it's only an acanthomatous ameloblastoma, but it's a signal you need to take a better look. There's one again, different complete appearance, but lots of bone destruction already occurring between these two. And consequently, we did exactly what we try to do, is to save the jaw. Another one right in front. So this one's a little bit different. So there's the tumor. This is a small dog. So we had to go 1 centimeter all around that tumor. So that's a ½ inch. So that means we took this canine, all the incisors, and that canine to stop the growth of this tumor. It's quite a bit. So the jaws are going to be shorter. But the dog's going to live, and it's not going to come back. And the dog probably won't notice that happen at all. However, the owner's biggest complaint is now the dog moves because it can't keep its tongue all the way inside its mouth. So there's always a consequence. Nothing is perfect. So a biopsy will help formulate a treatment option. It's the very, very, very first thing that your veterinarian should do anytime there's a lesion. Is biopsy first. Be aggressive with the biopsy, develop a surgical plan, make sure you give margins, do the surgery, wait for the pathology report. So the clinical appearance, as we mentioned, is not diagnostic. They can all look a little bit the same. This one turned out to be a fibrosarcoma. We were able to get margins, which is pretty unusual for most cases of fibrosarcoma, especially one that had that large tumor. So if anything I could pass on, yes, there's other modalities for treatment. Surgery is by far the most successful, just like it is in people. But biopsy is the very first thing we should always do. Questions?
Let me grab our Zoomers.
Do you guys have any questions? First in person, you get priority.
Go ahead. So my concern really is to not necessarily think that the dog needs hard things. So in the wild, carnivores never eat carnivores. But I can't tell you how many dogs eat bones and carnivores. They eat the meat, they eat soft tissue. Their teeth were not designed to eat anything hard. If you look how thin the enamel is on a dog tooth, the enamel on a dog tooth, that's the outer coating, is 1/10 the thickness of the enamel of our teeth. Our teeth were designed as molars to chew on hard surfaces. Dogs' teeth were not. Their teeth were designed to shear soft tissue. That's why you see that pinking action on the side of their mouth. That's why they have big, large canines. That's to grab things. But their teeth were never designed to do anything hard. So if you can't bend it, sort with your fingernail, you're not doing your job okay. So let's back up 1 second with that. So how many of you get your dog's teeth cleaned once a year? How many of you get your dog's teeth cleaned every other year? Why do you do that?
I use a scaler.
So the misconception is that the amount of calculus on the tooth is the reason you're getting your dog's teeth.
Right.
That's incorrect.
Oh.
Correct thing to think about is if you're brushing the dog's teeth, the only thing that's important is the gingiva. The calculus causes no disease whatsoever. It causes odor, and that's it. But if you're not brushing, then the assumption is there may be calculus underneath the gum. That is really the key. So if you had your dog's teeth cleaned and you didn't have x-rays taken of your dog's mouth while they are being cleaned, you're wasting your dollars. Because you're not looking for any pathology, you're just looking for something cosmetic. So if you and I never brushed our teeth, ever, and we went in for a teeth cleaning once a year, in 2 weeks we'll look just exactly like we did before we went in. Because the only thing that removes that biofilm is mechanical removal with the toothbrush. So that's why people don't come in with mouths that look as bad as those. If they brush their teeth, usually periodontal disease is not the end result of toothbrush. It's the people that don't brush and the dogs that don't brush that end up with periodontal disease. So what you give them to chew on only affects these teeth way back here. You're not chewing with those things up here using milk bones or whatever doggy treat you want to get them. But if you want to look for something that'll help, go to the website bohc.org, veterinaryoral.health.council.org. If products have been tested and shown to be effective in reducing plaque encounters, it does not eliminate the is it? By somebody knows the actually, anything that will allow you to get your toothbrush into dog's mouth. So I usually tell people start with beef oil, put it on your finger, salty, protein tasty, rub it across all their ginger, I guarantee a golden will go crazy. They'll start drooling before you can get your feet. As soon as they accept that, hit the toothbrush. Brush the teeth. You're only doing the outsides. You don't have to do the insides. So the tongue does a really good job at the insides. So if you looked at Ellie's teeth, and I mean, she's almost 11. I mean, I do think about, man, I should take her in, do a professional cleanup. But I've got a light that shows me anything that she has disease-wise. She's never had it, but I don't miss any days. I mean, she gets it ready every day.
Is that a human toothbrush or a dog toothbrush?
You know, it really doesn't make a huge difference, but I would tell you that the gingiva on a dog is more sensitive than the gingiva on a human.
Oh.
The keratinized tissue is thinner, so you should use a really soft toothbrush. And they won't last very long, maybe 3 months, but in all honesty, that's all we're supposed to be using our toothbrushes for, 3 months.
Right.
You know, there's a lot of controversy as to periodontal disease. So I could have periodontal disease. You could have periodontal disease, but our bodies fight it differently. My body might do a great job as my mom. Same thing happens with dogs. So not all the pathogens are the same with every dog. So I would recommend getting your own brushes. However, you can argue the fact that you ran out of the same ball.
Good point. From the crowd, let me tell you, well, first, I think you've addressed a lot of the questions about the tennis balls and how to protect their teeth. We do have one person that said that they do have, repeat the question. Okay. The question is, my dog already has shown some teeth cracks from gnawing on antlers. What is your recommendation to try to keep healthy and further deteriorating?
So the very first thing I'd tell you is throw the antlers away.
Throw the antlers away.
Second thing I would tell you is you need to go have all those teeth x-rayed, and in 6 to 9 months, have them x-rayed again to see if any pathology has changed, because cracked teeth will not heal themselves. So if they have a crack, they need to have professional films taken to evaluate the teeth.
Okay, thank you. The second question is, I brush my dog's teeth and scale regularly. What can I use that is effective for a water mouthwash? I had one no longer available that worked well. I'm now using Pro Care, which I do not think is as effective.
So the very first thing I would tell you is nothing removes the biofilm underneath the gum line except the toothbrush.
Okay.
Scaling the teeth with the scaler scars the enamel. So it makes, unless you're polishing the teeth afterwards professionally, you're creating niches for more biofilm to attach to that tooth.
Okay.
So if you want to find products that are good to be used, I would still reference the website, bohc.org, veterinaryoral.health.org, so that you can find products that would be appropriate. But your best solution to all of those would be brushing. If you're brushing daily, the biofilm can't mineralize to form calculus. So the biofilm will mineralize in 48 hours. So if someone tells me they're brushing their dog's teeth every other day, And that's why they're developing calculus on the teeth, because the biofilm will memorize within 48 hours. So brushing daily, it's a gold standard.
So that's it.
That's
Just brush. Do your dog a favor, brush their teeth. Okay, I don't have any other questions for you.
How old is he? Age, he's just getting, he may be a little delayed, he's just getting his adult incisors. He doesn't have the adult canines in yet, they won't run for another month and a half. They tend to be a little slower at erecting their teeth. So I don't recommend brushing puppies' teeth. I do recommend you getting in their mouth, but mostly with your finger and something that's pleasant for the dog to taste. Wait until the adult teeth come in, and then Shih Tzus are one of the breeds that oftentimes does not have complete dentition. So it's going to be really important that you advise somebody, whether it's going to be a show dog, spayed or neutered, feediness, whatever, or it's just going to be a house pet. They need to look to see if it has full dentition. They were one of the first that actually on the outside of the band, all use teeth science and we don't say DOHC except if you look at greens, they'll say DOHC except. So that means that at the minimum, reduce fire. So, no, the reason they don't is as soon as they're so, grease is one of the things that Mars.
So that was VOHC
V is a Victor, Veterinary Oral Health Council.
or Health Council. Okay. Thank you so much. Thank you very much for that was so good.
Thanks, everybody. Good night.